Yes, the first profound difference is that in men, the most prevalent manifestation of ischemic heart disease, now let's focus on ischemic heart disease, the most frequent presentation for men is characterized by obstructive atherosclerosis. In other words, flow limiting stenosis, which develop in the coronary circulation and eventually leading to angina or acute myocardial infarction. While in men, the most prevalent presentation is represented by coronary microvascular dysfunction. In the past few years, in the last 10 years mainly, we have been learning that the clinical presentations of ischemic heart disease are more complex than we thought many years ago, because there are two fundamental mechanisms which can lead to ischemic heart disease. One mechanism is represented by an anatomical alteration of epicardial arteries, leading to the formation of coronary stenosis, and this is more prevalent in men. But another presentation is represented by a functional alteration of coronary circulation, in particular of coronary microcirculation. In this case, we do not have stenosis, but we can have angina and ischemia caused by a functional alteration of coronary microcirculation. This second form, a functional alteration of coronary microcirculation, is more prevalent in women than in men. At the end of the day, the outcome is similar for men and women. As I said before, 20% of men and 20% of women die because of ischemic heart disease. Although the clinical presentations are different, but the outcomes are similar. Another major difference is that because of the what we call estrogen umbrella, the protection given by estrogen, the onset of disease in women is about, on average, 10 years later than in men. So the onset of disease is to some extent, takes place to some extent later in women than in men, but unfortunately, women then catch up very quickly, and at the end of the day, mortality is almost identical for men and women.